Women's Open history in the making.
LPGA Tour golfer Amy Olson will play at Pebble Beach while 30 weeks pregnant. There are both risks and rewards for expectant mothers when working out. So let's bring in OBGYN Dr. Jesus Samaniego with Kelsey Seybold Clinic. Good morning to you, doctor. We're glad you're with us. You would think that a major championship would be pressure enough, but you add in pregnancy. Are you concerned when it comes to stress like that on an expectant mother?
Well, of course, there's some concern. Good morning, Melissa and Sally. But the better fit a mother is going into a pregnancy, the better the outcome for the mother and the baby. This speaks really wonderfully to that concept of a mother maintaining her fitness level as she enters the pregnancy and maintaining it throughout the pregnancy.
Yeah,
I have no doubt that Miss Olson has a great team to be watching over her.
Sure, and that's the thing of she's been golfing throughout it. It's not like she's picking up golf 7 months pregnant.
Right.
So she's been doing the same thing day after day after day. Do you have any concerns though I just tried to picture myself when I was 7 months pregnant and you're way out here and you picture that twist and the torque. Is there any concern with that for her or the baby?
No, there really isn't. I mean, I think she's going to need to modify her swing, of course, and that may change her performance. And that's a really important idea as the pregnancy advances, and women exercise, that they are very mindful of the way that their body is behaving. They want to, be aware of anything that might cause them discomfort, dehydration, exhaustion, and then respond to that in an active dialogue with their doctor.
So be willing to adapt is the message, it sounds like.
Right.
What types of exercise do you recommend for a woman who is expecting, who maybe is not used to doing a lot of high intensity, cardio or heavy weight training?
Right. What we want them to do is to begin at their fitness level, and so they can swim, they can do Pilates, they can do yoga that's modified for them for pregnancy. They can also begin, some gentle walking, and then if they can do more than that, they can walk, in a brisk pace, or even some light running. Stationary bicycles are often very safe as well.
Oh, that is good to know, because it is the better shape you are, I think the easier it makes it for the mom when time for the baby comes. What are signs though for a pregnant woman that maybe it's time to ease up on that workout a little bit? What are some warning signs you really want new moms to know about?
I think they really want to be mindful of discomfort. In other words, as what they're doing, normally women that are very fit will push through the discomforts that they have, to the end of their workout. But here, what they want to do is they want to pull back a little bit if they start feeling uncomfortable, and then the dehydration part, which is really important for the Gulf Coast. Oh my, we have to be very, very careful with dehydration and mothers getting overheated. So exercising in a place where there's good ventilation, where they don't feel overheated and they have hydrated well ahead of time and during, I think is really important.
Dr. Samaniego from Kelsey Seybold, thank you so much for joining us today. We hope you have a great day. Stay cool out there.
Thank you, you too.